Hello, my name's Mrinalini Dey. I am a clinical fellow from London in the UK, and I am at ACR 2024 in Washington, DC. And I'm delighted to have with me today Professor Elena Myasoedova, who is Professor of Medicine at Mayo Clinic in the US. Thank you for being with me here today. So we have just come out of a really exciting and highly relevant session on aging in aspects in the rheumatic diseases. And first of all, I'd like to get, if it's okay, I'd like to get your thoughts, Professor Myasoedova, on why this session is so necessary. And I believe also that the Lancet Rheumatology has recently published a special edition on this topic. So why do we need to know more about this topic, and why is it so important?
Thank you so much for having me, and yes, I agree that the session that just ran here at the ACR sheds the light on the understudied and underappreciated topic of aging and rheumatic diseases. The guidelines and the care do not necessarily imply or focus on aging aspects with treatment or screening or in general management plans and prevention for patients with rheumatic diseases, which needs to be done. And the session shed some light on the aspects of things from that standpoint.
You mentioned about the guidelines, and I know that was talked about in the final talk of the session, so I'd just like your thoughts on that a little bit more. So, the guidelines that we currently have don't necessarily meet the needs of our older patients, and I think the same could be said of recruitment to clinical trials. What do you think we can do to improve both of those aspects, and what can clinicians do on a practical level when they're seeing patients?
Yeah, great questions. So certainly, age is a number that doesn't apply equally to different aspects to different patients and different aspects of things in terms of, for example, administration of treatments or choice of treatments, and guidelines do not necessarily highlight that patients of certain age should or should not receive a particular treatment, and it shouldn't really be a barrier in itself. Certainly with age we accumulate comorbidities and other polypharmacy, and that can preclude the use, or at least become a worrisome aspect of use of certain disease-modifying agents, for example. But other than that, literally treating patients who are older similarly otherwise with the younger patients is probably reasonable.
Thank you. Let's just pick up on the aspect of comorbidities a little bit more. So that also came up quite a bit in this session that we've just been to. The clinics are time pressured for rheumatologists. I work in the UK, you work in the US. I think the problems are fairly similar from that point of view. How can we best manage and address comorbidities in the clinic setting when we have such limited time with our patients?
One way to do that would be to certainly use teamwork and multidisciplinary care. It's not always feasible, and that's where potentially screening instruments come into play, such as screening for cognitive impairments, screening for functional impairments, screening for depression, anxiety, and such, and then referring to a particular provider. But certainly if you have an infrastructure to use multi-specialty approach, that probably is an optimal way to do it. Although that said, rheumatology as specialty deals so much with patients who are older just by the nature of our specialty that picking up some of these skills is important in itself for rheumatologists, and that's why that essentially justifies the topic of geriatric rheumatology that we are trying to introduce with the session and with the series.
Thanks. One thing that really struck me, I'm just remembering the slide from our second speaker, was that the fact that DMARDs are not prescribed so readily in our older patients. And that actually includes the population who have late onset RA, and that really struck me. What more do you think we can do to improve uptake there? And I know a few of the aspects were touched on in the Q&A, such as infection risks, for example. But yeah, how can we improve that to improve outcomes ultimately?
Yeah, there's definitely hesitancy in administration of immunosuppressive agents as people age, but that's partially because there's not enough evidence about how these agents work and how they compare in this particular population, because older adults frequently, especially multimorbid patients or patients with multiple chronic conditions rather, are frequently excluded from the clinical trials, and pragmatic trials for rheumatology may not be as prevalent at this point. So one way to improve things would be to do more interventional studies that are prospective studies, ideally exploring the ways how to optimize treatments. And not only prescribe, but there's also an aspect of de-prescribing. There's definitely some balance there. And I think both of those aspects can be improved and researched more. And that's where we're heading.
Thank you. And I think we could talk about this all day, but we don't have unlimited time. Where can people go if they want further information? I mentioned at the beginning that special edition that you've just been involved with. So yeah, if we want to know more, how can we find out more about this topic?
Definitely. So Lancet Rheumatology just published a series of papers on aging in rheumatology in patients with rheumatic diseases that include a manuscript on cognition in adults with rheumatic diseases, a paper on geriatric 5M, the 5 major aspects of older adults' care, such as multimorbidity, multi-complexity, mind, mobility, and what matters most. Those are the 5 M's. A paper on frailty, a paper on palliative care, and there is also a paper on ageism. All of these are extremely important, and this can be a good reference. We are trying to also grow the awareness and the presence of understanding of geriatric rheumatology as a subfield. Certainly, if you would like more, communication, more information, our group Geri Room is fairly active on social media, and all of us are very approachable as well.
Thank you so much. Thank you for taking the time to talk to me after that really excellent session. If you'd like to know more, as Professor Myasoedova said, do check out that special edition of the Lancet Rheumatology. And also there's plenty of other sessions which touch on multimorbidity aspects of aging here at ACR. And if you'd like to know even more, then do check out the Room Now website for further information. Thank you.